Welcome back to Face the Nation. This morning, the number of deaths in the U.S. due to COVID-19 has officially reached yet another tragic benchmark, 140,000. Dr. Richard Besser is the president and CEO of the Robert Wood Johnson Foundation and the former acting director for the CDC. He joins us from Princeton, New Jersey. Good morning.
Good morning, Margaret. Good to be here.
Well, Doctor, I'm glad you're here. I want to first ask you, because I know you worked in Atlanta. You knew Congressman John Lewis, who, as you know, passed away on Friday. In reading up on him, it stood out to me that he had spent a good deal of time on health disparities in the minority community and worked on that issue. And I wonder if that's something you collaborated with him on.
Well, you know, we didn't work directly, but I lived in his district, and his district included the CDC. And in his entire career, focused on civil rights, focused on trying to undo structural racism. It has a direct impact on health. He was active until the very end of his life. And in preparing to come here to speak with you, I found a quote that he has from May in a congressional committee. He said, "In the wake of this deadly virus, we should admit we've fallen short. Health inequality is once again costing lives on a scale that no one can ignore. In order to save lives and right this wrong, we must listen, learn, and take action." And most importantly, he called on Congress to put ego and ideology aside. And that's one of the biggest challenges we're seeing right now with this pandemic.
Well, to that point, according to CDC data, Hispanics, Latinos are hospitalized nationwide for COVID-19 at 4 times the rate of whites. The Black community, we know, is disproportionately impacted. You're a pediatrician by training. Do you expect these patterns that we have seen to be replicated among children when we look at the possibility of them returning to classrooms, at least partially, in the fall?
Well, if we're not intentional about making sure that doesn't happen, it will happen. The death rate for Blacks, Latinos, Native Americans far surpasses their proportion of the population. And if you look at how we fund schools in America, most of it's done off property taxes. So wealthy communities are going to be able to make the adjustments to their schools that are necessary for them to be safe places for children, for teachers, and staff. That's very expensive. It takes looking at your airflow. It looks making sure that you have enough classrooms so that you don't need as many children in each class and they can socially distance. It means hiring staff who can decontaminate classrooms and disinfect them every night, and staff to screen staff and children every morning. And in low-income communities, schools have been underinvested in for generations. Without additional resources, we will see children of color, Black and brown children, disproportionately affected as schools start to reopen.
You know, you warned in an op-ed this week, it got a lot of attention, along with 3 other former CDC directors, that health data is being politicized in a way that you said is really unprecedented. You said the terrible effect of undermining the CDC plays out in our population. You called it willful disregard for public health guidelines, leading to a sharp rise in infections and deaths. Are people within the CDC telling you that they feel their health data is being undermined and politicized?
Well, what I'm hearing and what I'm seeing are the same thing. And that's that CDC is not out front in their typical traditional leadership role driving the response to this. And we're seeing political considerations continually overtaking those of public health. We have the world's leading public health agency, and they provide direction not just across the federal government, but to state and local public health. And without them leading this response, without it being driven by science, we're going to have what's happening right now, which is an out of control pandemic, continue for months and months and months to come.
But respectfully, though, you know, the CDC has admitted having made some mistakes, not just, so, you know, there is a question here about their competence as an agency due to these early admitted problems with testing kits, slow to warn the public about the idea that there's asymptomatic transmission and aerosol transmission of this. The mask guidance was very, very late. What's going on? Are they falling short,
yeah.
or are you saying they're being muzzled?
Well, I think there's a little of both going on here. You know, I ran emergency preparedness and response at CDC for 4 years and led the agency during the start of the swine flu pandemic in 2009. And every response to a new public health emergency, you'll try things and some of them won't work. But when you're in a daily conversation with the public, you develop trust. You explain what you know, what you don't know, and what studies you're doing to try and learn. And so when you try something and it doesn't work, you have the opportunity to explain what you've learned and what you want to do going forward. The mask issue is a great example. Early on, the CDC was not recommending masks in public. They were recommending masks for healthcare providers. But increasing studies and data showed that because so many people can spread this before they have any symptoms, there was value in the general public wearing masks. But without CDC meeting every day with the media, hearing what the public and the press were concerned about, there was no way to bring the public along on that journey. So it looked like a flip-flop, and it didn't lead to people making those changes. I found the questions that I got from the press every day led us to do a much better job at CDC.
Well, obviously, we're talking our own book here, but we would love to have the CDC director on the program. And we thank you for your time today. We'll be right back. We go now to former FDA Commissioner Dr. Scott Gottlieb. He joins us from Washington. Good morning.
Good morning.
So we are now just under 1,000 deaths a day from this virus, roughly 70,000 infections per day. Last Sunday, you said the apex would be 2 to 3 weeks. Do you stand by that now?
Well, I think the apex in the epidemic states right now, the center of the epidemic, which is California, Texas, Arizona, and Florida, could be 2 to 3 weeks away. You are seeing some slowing in the new cases. It's not clear whether or not the new cases are actually slowing, or these states are just hitting the upper limit of their testing capacity. Arizona certainly seems to be hitting the upper limit of its testing capacity. The challenge, though, is that as these states start to peak, and I think they're going to have an extended plateau, I don't think this is a sharp up and a sharp down, but as they start to peak, we're seeing other epicenters of epidemic spread start to emerge. So you have to be very worried right now about Georgia, about Tennessee, about Missouri, about Kentucky. We're seeing record numbers of cases, rising hospitalizations, and really a shifting of the center of the epidemic potentially in the United States. And this just portends more trouble for the fall and the winter, that we're going to be taking a lot of infection into the fall, that we're never going to really be able to come down.
Well, the CDC director said this week if everyone wore a mask, you could get this under control within a matter of weeks. He said 4 to 8 weeks. Is that wishful thinking?
Well, I think it might be wishful thinking that everyone's going to wear a mask. There's a hardened percentage of the population that just feel that the masks are some infringement on their liberty. We've been unable to find some kind of acceptable medium in this country between hapless spread and strict lockdowns. If we can come to a consensus about some reasonable measures that we all agree to take, we could potentially get this under control and keep it under control. Masks are an important first step. But I just don't see enough of the population agreeing to wear masks. If 30% of the population won't wear masks any time, and then you only have maybe 75% compliance among the other portion of the population because nobody's going to do everything all the time, that might not be enough mask wearing to really get this fully under control.
Testing delays, we're still hearing about them. In a first world country, should you accept testing delays of a week or more?
No, look, we've had plenty of time to get this right. We've had now 5 months since we first identified a shortcoming in the testing in the United States. What we don't have is excess capacity that we could surge into these epidemic cities. And so when you have epidemics in Texas and California and Florida, and the testing companies, the big commercial labs like LabCorp and Quest, try to prioritize tests in those regions, not only do they fall behind in those regions, but now they're pulling testing out of other regions, and you're seeing delays there. So once a test is delayed more than 48 hours, it becomes not very useful for clinical decision-making. We're seeing delays of up to 6 or 7 days right now.
Well, that has consequences, obviously, for bringing anyone back into an office, into a school. What do you think is about to happen, given what we're seeing with the trend of infection rates among children? Do we know yet how this virus affects young people?
Well, we know that children are less likely to get infected, and when they do get infected, they're less likely to be symptomatic. That seems to be accepted based on the literature. What we are unsure about is what their propensity is to spread the virus once they do get infected, and particularly when they're symptomatic. they do appear as likely to spread the virus when they develop symptomatic illness. And that might be because they shed as much or because of their behaviors, that a child's more likely to introduce it into the home because you're going to hug your child even when they're sick. Now, the literature on outcomes in kids is scant. And there was one study, one reliable study out of China, looked at 2,100 kids who developed symptomatic illness. And about 5% developed severe disease requiring oxygenation, and about 0.6% developed very severe disease requiring admission to an ICU, so multi-organ failure, acute respiratory distress syndrome, and shock. That's the one reliable study. Now, that said, children are far less likely to develop symptomatic illness, and this just looked at the percentage of children who did develop symptomatic disease. But what it suggests is that when kids do get sick, they have a propensity to get very sick, albeit in a small proportion relative to adults.
But then we've also seen these syndromes that happen after the virus, the Kawasaki effect I'm thinking of there. Given the infection rates going up among kids, does that mean we will soon see Kawasaki to be more prevalent?
That's right. So multisystem inflammatory syndrome is currently being investigated. It does appear to be a post-viral syndrome, some kind of immune-related phenomena in children, similar to Kawasaki disease. The one good study that came out of the CDC estimated that it occurred about 25 days after the onset of symptoms for kids who were symptomatic, but it also occurred in a lot of kids who had asymptomatic illness. And the median age was about 8 years old. And so given the fact that we've seen a spike in infections among kids, we would expect in about 2 or 3 weeks we might see a surge in these kinds of cases getting reported. That will be right about the time that we're looking to send kids back to school. So that could cause a lot of districts to become wary. Remember, when these symptoms first emerged, when the syndrome first emerged over the summer, we were just ready to start opening camps and sleepaway camps. And when these cases started to emerge, that caused a lot of camps to make the decision to shut down. So we do have to try to get kids back into school. We need to be mindful that we may see a wave of these post-viral syndromes happening right when we're trying to do that. Finally, we still don't know what the denominator is, so we don't know how many kids have been infected, but this does appear to be a rare consequence.
Just quickly, you heard the former CDC director say the CDC is being undermined. Given what's happening now and the controversy over data collection, do you believe that's what's happening?
Well, look, I think what's happening is there's been longstanding frustration by the administration with CDC, some of it founded and some of it unfounded. The final straw this week, I'm told by people in the administration, was when the CDC told officials that they wouldn't be able to provide age breakdowns on the people who are hospitalized until the end of August or September. So there's frustrations with the CDC's ability to collect and propagate data. Now, that said, I think they should have worked to try to reform the CDC rather than pull these functions away from CDC. But I think that's primarily what's going on.
Well, we will continue to watch what happens there and listen to our health officials. Thank you very much, Dr. Scott Gottlieb, for joining us. We'll be back in a moment. We want to go now to the president-elect of the University of California School System. That's Dr. Michael Drake. He joins us from San Francisco. Good morning to you, Doctor.
Good morning, Margaret. Nice to be here.
Glad to have you. I know you're in a transition, having been at Ohio State previously, and I read that while you were there, as an administrator, you also taught a course on civil rights. And given the passing of John Lewis, I'm curious what you as a professor taught your students about his legacy.
Well, thank you. Yes, I taught a course that began when I was the chancellor at the University of California, Irvine, and then moved that course with me to the Ohio State University, and had a course that I taught with my co-teacher was the dean of the law school in both cases, and the course was on civil rights, the Supreme Court, and the music of the civil rights era. And we went through from 1954 to 1968 the milestones in the civil rights movement. And one of the places that we focused was the Freedom Riders in the early 1960s. Very interesting to our students because those people were very young, like our students were, and John Lewis was a leader of that movement, so we focused specifically on him. I had the opportunity to meet him. He was a courageous and inspiring figure. General Powell was on earlier today, and he mentioned Congressman Lewis's humanity, his generosity, his kindness of spirit, and how wonderful it was to have a person who was so kind and thoughtful as an individual, and at the same time so courageous and committed to making this country a better place. So this is a great loss. He did a great deal to help make this country better.
Well, I'll ask you to put your administrator hat back on.
Yes.
Now that you're at UC, they have taken some high-profile steps to attempt to increase diversity within the school system. One of the more controversial ones was this decision to do away with the requirement of SATs or ACT tests in the future. Despite some arguments within the university that doing so would result in lower grade averages or lower graduation rates. And I wonder how you think about addressing these concerns that eliminating a standard somehow lowers them.
Well, we're in no way attempting to lower standards at all. We have a variety of things that we consider in admissions. I was in charge of admissions for the UCSF Medical School for many years in the past, and we use a variety of things to determine the qualifications for students who are going to be admitted to our universities. We're very proud that we have so many students interested in attending, and we have to judge between them. And what we found is that standardized tests provide marginal information. They can help, but they don't tell the whole picture. And particularly in this time of COVID, when the opportunity to study and prepare for a test is quite uneven between those students who might be applying for us, we wanted to remove any potential barriers for students who might not have access to all the support that they need during this time to prepare for taking the test, and therefore artificially score lower than they might. So the plan is to retreat from those standardized tests now and to think about other ways that we might gather that information as we look forward in the future. It's an ongoing discussion for us.
As we mentioned, you're also a medical doctor. And when you look at California and the case count seeming to increase there, would it be helpful to you as an administrator to have a national benchmark setting an infection rate that would help determine whether it's safe for students to go back into the classroom or not? Or is it more important to you to have the ability to decide that at the state level or on your own?
Well, there are several things. It's important at the local level, but we are, although we're a state university, we're an international university, so we have students and faculty coming from all over the world, particularly students coming from all over the country and all over the world. So what happens in the world happens at the University of California and vice versa. You know, we have nearly 300,000 students. Most important thing for all of us, I think, in this phase is to wear masks. I think there's nothing more, that's the most important thing we could do today to try to get back to something that looks like normal as quickly as possible. Our scientists and scientists around the world are working on developing better treatments, working on developing a vaccine, but those things are months or many months away at least. Today, to help stem the spread of this virus, the most important thing for us to do is to wear masks to protect others and protect ourselves. And we see that when mask wearing is done by a large fraction of the population, the infection rate is held down. And, and when that's not done, the infection rate goes up, and I think that you get to choose. And I think we need to choose to make ourselves safe and to do all the things, wear masks, socially, physically distant, use hand washing. But those are the most important things for us to do in the short run, most important things to do today to help us have the future get back to normal as soon as it can.
Thank you, Doctor, for your insight and your advice today. We'll be right back. Since we began this broadcast with a report from Bob Schieffer, we thought it would be fitting to end with some thoughts from the other resident former Face the Nation moderator, John Dickerson.
On Bloody Sunday, John Lewis wore a backpack. It contained fruit, a toothbrush, and 2 books. He expected to spend the night reading in jail. Instead, he spent it in the hospital, his skull fractured from a police beating. He would carry the scars of that beating for the rest of his life, and carry out the rest of his life between those 2 books that he carried. One book was The American Political Tradition, a reappraisal of the country's history. The other was The 7-Story Mountain, Thomas Merton's journey to a life in Christ as a Catholic monk. It was Christ's instruction to love thy neighbor that drew Lewis to Martin Luther King's nonviolent message, which they would use to challenge the American tradition. How does a young man find the courage to sit before open hatred at lunch counters and stand before police lines protected only by an idea? Hope That monk, Thomas Merton, wrote, "By hope the abstract and impersonal become intimate conviction. What I believe in faith I possess and make my own by hope." That was John Lewis's hope. Not happy talk hope, but a durable, tempered, saving conviction that a belief in love, common humanity, and the pursuit of equality will win in the end. In the face of a billy club, hope is a walking stick. I asked Lewis about loving thy neighbor a few years ago, sitting at a replica of one of the lunch counters where he started his protesting career.
Where is that message now?
The message is still embedded in many of us. I think we have to teach all of our children, and those of us not so young, that the way of love is a better way. Just respect the dignity and the worth of every human being. We need to continue to get it out there. And if we get it right, I really believe, if we get it right in America, maybe it can serve as a model for the rest of the world.
It's hard to hold on to hope in the face of cynicism, bad faith, and deceit, but doing so is what makes hope so durable. It has value because people like John Lewis purchased it through suffering and sacrifice. He believed America was worth the hope and the pain. Lewis's hope also filled him with irrepressible happiness, despite all that he'd been through. He was still living by a hope in equality at the end of his life. A life that is a monument to hope, belief in it and the power of it. John Lewis stood up by sitting down. They tried to deny his march, but he reached his destination. Now that his journey is over, his history is testimony to the power of hope that speaks to all of us. The political book in that backpack starts with a quote from the writer John Dos Passos. In times of change and danger, when there is a quicksand of fear under men's reasoning, a sense of continuity with generations gone before can stretch like a lifeline across the scary present. John Lewis was that lifeline. He still is.
That's going to be it for us today. Thank you all for watching. And we want to apologize for a report earlier that said John Lewis was born in Georgia. He was actually born in Alabama. Until next week, for Face the Nation, I'm Margaret Brennan.